Coping with life isn't always easy. Sometimes big, cold obstacles are put in our way. If that happens to you, don't feel alone. We all have to cope with something, even if it can't be seen by others. In this show, we are going to learn about those things that other people have to live with. How do they cope? How can we help? Get your passports ready, because we are about to depart upon an exciting tour of life and life's inconveniences.
Welcome to Coping with Life. I'm Joyce.
Recently, we had a reporter talk to some children and doctors about cancer and the Children's Hospital of Orange County, located in Santa Ana.
70 to 75% of childhood cancers are curable, but it doesn't make it any less scary for the young patient. And what do you call this therapy?
Recreation therapy.
Does it have a special name since you deal with children?
I'm a child life specialist, but I work in the recreation therapy department.
Now, what kind of impact do you think this therapy has on children, as opposed to, let's say, a child who doesn't have therapy?
Recreation therapy really has very positive outcome with the patients. They learn all about the medical setting and how their body works, the things that they have to do to help make themselves better. The recreation therapy helps their emotional and their psychological state, which in turn will affect their physical state as well. There's a lot of research out right now that suggests that a healthy mental state will help make a healthy physical state.
What do you tell a child when they say, "Why can't I go out and play like all the other kids?"
I generally say you can. Most of the kids up here play and act just like any other children. They may not have hair, but boy, that doesn't slow them down a bit. They just keep going like just regular kids.
What's wrong with your patient?
She had to come in for a bone marrow harvest, and I had one
Oh, and you had one.
right here.
Does it hurt?
Yeah.
What's wrong with her? What does she have?
When she was born, she never opened her eyes.
Yeah. And why do you wear gloves?
To keep the germs off the baby.
And you're
At Children's Hospital, we have a doll called a Zadi doll that we use to educate children about what is going to be happening to them. We're able to show them the different parts of the body that they have. We could talk about the ribs and the different organs that are within. It's anatomically correct, and it has a spot where they can have the IVs placed. We tell them how the IVs work and why they are there. We show them how they have procedures on their back sometimes for bone marrow aspirations or spinal taps, how the spinal column works and how they have to bend and hold their body. So we can give instruction by using these dolls. This doll happens to have the hair that comes off. A lot of the kids on this unit have cancer, and because of their chemotherapy, their hair falls out. So it's nice to be able to explain how that happens rather slowly and sometimes faster to other kids. But when they're done with their treatment, then it will grow back, and kind of is a way to reassure patients. And at CHOC, we think that's real important that they have that understanding.
Finally, Bentley reporting for Coping with Life.